Hello friends, there is a new NMC notification that has come out which is very ambiguous, discriminatory and atrocious towards foreign medical graduates. As per the notification released by NMC on 7th June 2024, it says that all the foreign medical graduates who have attended their classes online for any duration during their course completion are required to qualify the FMGE examination and subsequently undergo a compulsory rotatory medical internship for a period of 2 years, 3 years, a schedule of 12 months to be repeated. कहना क्या चाहते हो भाई? कितने साल की इंटर्नशिप करें? 1 साल का, 2 साल का या 3 साल का? So this ambiguity has to be cleared. It is creating a lot of panic and distress for the medical graduates. As far as online education is concerned, not just foreign medical graduates, the entire world, including Indian graduates, underwent online training during the peak of COVID. And that was the only solution available at that time. And no country or no authority has ever punished the students like this for that. The online education happened only during COVID and war times. Do not blame or punish students for this. This is very regressive policy, unnecessary and highly discriminatory. And what is the reason they are giving? It says it has been observed that many FMGs are maliciously obtaining compensatory certificates from their parent universities for the online classes carried by them. Do not punish all the foreign graduates who are in their universities abroad in their semesters having 100% attendance. Punishing everyone is not justifiable. And then they give this very nice moral science lesson in the notification. They said the medical profession deals with precious human life, therefore the life of Indian citizens cannot be put at stake of poorly trained medical professionals. If the authorities really care for the Indian patients, they should take action towards these quackery and the bridge courses that are rampant in the country rather than harassing these licensed, qualified foreign medical graduates. Let me list out the actual problem that is there. There is no clear guideline or universities mentioned or permitted by NMC for pursuing MBBS abroad. As per the guidelines, any student who has qualified NEET UG can pursue MBBS abroad. All that they say is you can go anywhere you want, you come back, clear the licensing exam and we will give you the internship. The issue is when NMC does not provide a list, this gives scope for a lot of fake universities and fake agencies to go on with their marketing gimmicks and lure lot of innocent students and their families. Our students with their dreams and aspirations to become a doctor but who cannot afford a private medical education in the country choose to take this alternate path of pursuing MBBS abroad. These are our Indian students who could not afford private medical education in the country. Do not punish, harass or be discriminatory against them. And universities which fulfill the criteria of proper training can be actually listed and notified to the general public to choose accordingly and to make the right decisions and prevent them from falling prey to fake universities and fake agencies. And after all the hurdles of staying away from the families at a very young age of 17 to 18 years, bearing all the expenses of foreign education, and many of these students are under education loans. Once the students graduate from their universities and come back to India, they are faced with a very difficult exam to validate their undergraduate degree, the Foreign Medical Graduate Licensing Exam. This exam, which is supposed to be a licensing exam, is actually a very tough exam on par with NEET PG with a very, very meager pass percentage of 10 to 20%. It takes a lot of training, lot of understanding of medical subjects, lot of hard work and lot of attempts to clear this exam. And even after clearing such a difficult exam conducted by Indian authorities, the harassment does not stop there. The harassment continues at various state councils for the allotment of internship. It takes roughly about 6 months to 1 year to get the internships allotted. Once the internship is allotted, does the discrimination stops? No. Even after Supreme Court ruling for providing stipends to the FMGs on par with Indian medical graduates, the FMGs are not paid their internships and are made to do bonded labor throughout their internship period without any pay. And because the allotment of internship is itself very difficult, the foreign graduates quietly accept this reality and complete their internship. And now to ask them to undergo internship training for 2 to 3 years is so atrocious on them and on their families. To make such young souls and aspiring doctors and their families suffer like this at a time when the family is already burdened by the financial strain of abroad education and with the education loans on their heads. The student finds himself very helpless, and this destroys the dream of being a resourceful doctor for this country. And most of these students, they reach a dead end of their career. A lot of serious thinking has to be going in this direction. And what timing to release this notification? Very close to the upcoming FMGE exam. This has created a lot of undue distress and pain for all the students who are exam going, and also all the students who are studying in different semesters who got admissions during the time of COVID or war situations during their academic period. And making them punished like this is very, very unjust. I strongly request the higher authorities to look into these issues and withdraw this discriminatory notification and take steps in providing correct guidance and assistance as a regulatory board for our own Indian students who want to pursue MBBS abroad in various countries. And I request everyone to spread this message and everyone to come together to get this discriminatory notification withdrawn, and I'll be happy to extend any support needed for this cause. Thank you so much. Jai Hind.